Hi everybody, Dr. Baumholtz, Baumholtz Plastic Surgery, and on this episode of Back to the Chalkboard, I want to go over 5 questions that I think you should ask your plastic surgeon or your medical spa. This is a twofer type video. So let's go over the 5 questions I think you should ask when you go for your plastic surgery consult. And they're not in any particular order, but let's just talk about them. Question number 1. Have you done the procedure enough times to be comfortable? I'll often get asked, how many times have I done something? And I'll ask the patient right back, how many times do you think I need to do it before you're satisfied with the answer, before you're comfortable with the answer? And so for me at least, certainly my own practice and when I teach or train other surgeons who do these procedures, it really is a matter of how often you need to do something to be comfortable. You may be surprised to learn it's often not a really large number, but really the question is, are you comfortable with the procedure? Are you comfortable managing what comes along with the procedure? All right, question number 2. What are the risks? I think the only surgeons who don't have risks either lie, downplay the risks, or don't do enough surgery. That's the exact line I use with my patients here in the practice, and I think it's an important thing to discuss. There's no such thing as a procedure without risk, and so what are they and how are they applicable to you in this procedure? Number 3. Where will my procedure be performed? Will this be done in an office setting? Will we be doing it in a surgery center? Will we be doing it in a full-scale hospital? And there's pluses and minuses for each of those, and I think you should discuss that with your operative surgeon. Next, am I a good candidate for the surgery, or is it just that my check cleared? A little tongue-in-cheek there, but the bottom line is what makes someone a good or bad candidate, and understanding how that surgical practice evaluates you as a patient, I think is an important step in choosing your surgeon and choosing the procedure you're going to have. Finally, what is the recovery and the downtime for the procedure? You know, people have busy lives, they work, they tend to children or parents, and so it's important to know how long you'll be outside of the game. Okay, turning our attention to the med spa side of things, who's doing the procedure and what is their level of training and certification? You know, the state of Texas allows a delegation of procedures, and so you really want to understand who's doing it, how much training they've had in that procedure, what their experience level is, and what their level of certification is. Who and where is the medical director and what is his or her background? So every med spa is required to have a medical director. In fact, you are to meet with this medical director if you're a new patient to that practice. And so you might ask, who's your medical director? Will I meet him or her? What's their background? Are they a plastic surgeon, or are they some other trained individual? And what's their experience with the procedure? Next, what are the risks of this med spa procedure, whether it's an injectable or an aesthetic treatment, and then how are the risks managed? Again, I mentioned the surgical side, there's no such thing as a procedure without some degree of risk. In the non-invasive or minimally invasive side, hopefully those risks are less, but you should understand them and also understand what, if anything, can be done if those risks happen to occur for you. Okay. What if I'm not happy with my results? Now, the answer may be that really nothing could be done, or the answer may be some form of a revision or refund policy if the practice has it, but better to talk about that before rather than after so there's no misunderstandings or no disappointment. Finally, am I a good candidate for this procedure, and who would not be a good candidate? You want to know if this newfangled device is being used on everybody or whether there is some selection criteria as to who's getting it and who isn't. There are some treatments that can be used for everyone, and there are some that require more selective application. Well, those are the 5 questions I think to help you in your decision as to where to get your treatments. If you have additional questions, please contact me here at Baumholtz Plastic Surgery. Have a great day.